Hi everyone, this is Dr. Hall here. We're going to start our first clay model of the anatomy of the semester, starting with the pectoral region. So I happen to have a skeleton model that is actually a Halloween decoration that I got for $4. If you can get some type of a skeleton model, that can make your job a little bit easier, but it's not that difficult to create something out of modeling clay yourself to show the relevant structures. So what you will need for sure is several different colors of modeling clay or Play-Doh. So you can see I have red. We're always going to use red for arteries, unless of course we're talking about the pulmonary circulation. We're always going to use blue for veins likewise. And we're going to use yellow for nerves. So those are going to be our conventions. We're always going to use those colors to designate those structures so that it's clear and easy to understand. You're also going to need some other colors to represent, in this case today, muscles. So I have also taken the liberty of, in advance, fashioning the modeling clay or Play-Doh into the shapes that I'm going to need so that this video is not too long. So what you might want to do is pause as we go along and go ahead and create the structures. So the other rule when we're making clay models is you're going to want to start with the deepest structures first and then build superficially. If you start with the superficial structures, then you have to remove them to place the deep ones and it gets pretty tricky. So we're always going to start with the deepest structures, which is not what you think of necessarily right off the bat. So it's a good mental exercise. So let's go ahead and get started. So today I've already started with the first blood vessel that we're going to do. So this is representing, this section right here is showing us the axillary artery. So you might remember the aorta comes off the heart, and then we have A, B, C, S, so BCS. So brachiocephalic trunk goes off to the right, left common carotid goes up into the neck, and then the subclavian artery is coming out towards the left side. So the subclavian artery, as soon as it passes over the first rib, it changes name to the axillary artery as it travels out toward the axilla or the armpit region. So here, from about here to here is our axillary artery, right there. We're going to be putting some branches, some arterial branches off of this artery on our structure today, but there's an even deeper structure that I want to do first, and that's a muscle. This muscle is called the serratus anterior. It's called serratus because it has these little serrated, pointy edges to it, so like a serrated knife. And it has those little funny edges because it comes out with these little finger-like projections and attaches to the ribs anteriorly. It attaches posteriorly on the anterior surface, which is kind of like the underside of the scapula. So that is the serratus anterior muscles. That's the first thing that we're going to go ahead and put in place. Now, one really cool thing about the serratus anterior muscle is that there's a nerve that runs right along the surface of it, and that nerve is called the long thoracic nerve. Okay, long thoracic nerve running right along, I hope you can see that at home, running right along the surface of the serratus anterior muscle. Okay, the next deep structure we're going to do is another muscle. It's a little tiny wedge-shaped muscle called the subclavius. Sub as a prefix means underneath, clavius referring to the clavicle. So we're going to find that right underneath the clavicle, right on the inferior surface, and attaching down to the first rib. That's going to allow you to kind of pull your clavicle down. The next blood vessel, or excuse me, the next structure we're going to add is a muscle, actually. It's the pectoralis minor muscle. It's called the pectoralis minor muscle because it's the smaller of the two pectoral muscles, and it's going to attach from the coracoid, excuse me, this has to go over here, from the coracoid process of the scapula, and then move anteriorly and attach to ribs 3, 4, and 5. So the Pec Minor muscle helps to elevate the rib cage during deep inspiration and pull those ribs up and out. Now we need to add a few deeper structures before we continue on. And to make life easier, I'm going to reflect back. That's what we call it when you kind of fold back like the pages of the book, the pec minor muscle. The first structure I'm going to add in here is the thoracoacromial artery. So the thoracoacromial artery actually has several different branches that come off of it, and we're just going to focus on one of them. So we've got this one long branch here and then that other short one there to kind of show you. And so that's the thoracoacromial artery. This long branch coming off of it is called the pectoral branch, and I'll show you why in a minute. There's another arterial branch out here, which is called the lateral thoracic artery. And the reason why I wanted to do this one next, oops, I lost my thoracoacromial, is because this one, the easy way to remember it, is that it travels down the lateral surface of the pec minor. That's our lateral thoracic artery. I'm going to put the thoracoacromial back on. Hopefully it'll stick. It's a little tricky. All right. So I mentioned this is called the pectoral branch, and you must be, well, why is it called the pectoral branch, aside from the fact that it's in the pectoral region? And that's because it is going to supply the pectoralis major muscle. So it's going to come out onto the undersurface, I have this upside down, of the pec major muscle. The pec major muscle attaches to the clavicle, and where it attaches to the clavicle, we call that the clavicular head, as well as to the anterior ribs and sternum. And so that is called the sternocostal head. And the fiber direction runs like this. Do I have a pen? I need to get a pen. All right. So when we look at the deep surface of the pec major muscle, stay back, pec minor, we will see the pectoral branch of the thoracoacromial artery. All right, a few more structures. So a couple of other deep things. Two nerves. One is called the lateral pectoral nerve. And the lateral pectoral nerve is going to travel with the pectoral branch out on the undersurface or the deep surface of the pec major muscle. The other nerve, that's going to break, is the medial pectoral nerve, and that comes through the pec minor. So you'll see it coming through from the undersurface and is also going to supply not only the pec minor, but also the pec major. So we've got, visible in this view, lateral thoracic artery, pec minor, medial pectoral nerve, lateral pectoral nerve, pectoral branch of the thoracoacromial artery. I'm going to go ahead and put the pec major back in place, and we just have a couple more things to add. So one is the deltoid muscle, named after delta for the Greek letter, which is like our D, which is kind of shaped like a triangle. So if you think about a river delta, it's a triangular shape. So the deltoid muscle attaches to the clavicle and the acromion of the scapula, and then down onto the humerus, right? So that you can do the chicken dance. You can abduct your arm, and you'll see that there's this little space here, and that is called the deltopectoral triangle. And that's an important landmark because this triangular space is where we are going to find this vein, which will then travel down distally into the arm. This vein is the cephalic vein. Now, cephalad means of the head, so that's kind of strange because it's not anywhere near the head, but it's carrying blood toward the head-like direction. So I don't know, I wasn't in charge of naming this vein. I would have named it differently. But the cephalic vein. So now we're looking at the most superficial of all of the structures. The most superficial structure that we're going to encounter in the pectoral region is the cephalic vein in that deltopectoral triangle. That's the reference, the landmark that we're going to use to find this vein. We have our deltoid muscle, we have our pec major with the clavicular and sternocostal heads. So let's go ahead and reflect that pec major laterally, and we can see the pectoral branch of the thoracoacromial artery, the lateral pectoral nerve, the pectoralis minor muscle with the medial pectoral nerve. Coming down alongside the lateral border of the pec minor muscle is the lateral thoracic artery. If we come around this way, you'll remember we have the serratus anterior muscle and the long thoracic nerve. Oh, and I've forgotten artery. So way out here, as we get towards the arm, we're going to find the subscapular artery. And it's going to come down and travel posteriorly, guess what, to the scapula. So subscapular artery, lateral thoracic artery, thoracoacromial artery with the pectoral branch that was coming out to the deep surface of the pec major muscle. What else have we got? Our subclavius muscle, and of course our axillary artery there. So that's it for the pectoral region. I look forward to seeing you in class.